Hello and welcome to this video. This is the first video in the series of videos on erectile dysfunction. In this video, I will try to simplify the causes of erectile dysfunction in a manner which is understandable by the common man. And my channel is a channel for andrology and men's health awareness. So I will try and give you reliable and authentic information from an expert as an andrologist about erectile dysfunction. So, what is erectile dysfunction? Also commonly called as impotence. The inability to achieve or sustain an erection to perform satisfactory intercourse, which gives satisfaction to the male and to the partner, entails a normal erection. When a male is unable to achieve the required hardness to achieve penetration and to complete intercourse, it leads to erectile dysfunction. If the erection is not hard or sustained, the partner is likely to be unsatisfied, and this can lead to a lot of stress among the couple and particularly in the male due to the fact that he is not able to achieve normal sexual intercourse. And this stress further aggravates subsequent acts of intercourse because as the male is stressed that he may or may not be able to achieve erection to complete intercourse, he keeps on thinking about it, and rather this stress leads to subsequent failures as the couple, rather than enjoying the act of sexual intercourse, goes into this vicious cycle wherein stress perpetuates further failure. So, what are the causes or the types of erectile dysfunction? Or you can say the first one, which is the most common, is the psychological factors in erectile dysfunction. In this group, the patient is physically normal and is able to achieve good erections on most occasions. In the psychological type of erectile dysfunction, physically the patient is normal and is able to achieve good morning erections. Morning erections signify that the system, that is the physiological process of erection that the patient can achieve, is normal. So such patients have good morning erections, but they fail during the act of intercourse. This type is very common among young, inexperienced males, especially those who have not had a act of sexual intercourse in the past. The psychological cause of impotence or erectile dysfunction is very common in young, inexperienced males because during the first act they may not be very confident, or there might be some technical error which leads to failure to attain a normal intercourse. And this initial failure can lead to anxiety, and this anxiety can have a psychological impact which leads to the patient not being relaxed enough and not being in the mood in the subsequent acts, leading to failure. So in this case, the patient is physically normal, but due to certain technical or psychological factors, fails. And these cases are generally simple to treat by counseling. The second, which is also a very common type, is the vascular type. Vascular type of erectile dysfunction. This occurs in patients who are diabetics or who have hypertension, chronic long-standing hypertension, which may be not very well controlled. It occurs in patients with thyroid disorders, and it occurs in patients with other vascular disorders. What happens is, due to hypertension and due to diabetes, there is a plaque formation in the vessels, there is narrowing of the vessels, and because of the turbulence, because of the fast high flow rate in hypertension, blood flow rate in hypertension, it leads to narrowing of the vessels. And the caliber of the penile arterioles is smaller compared to the heart and the brain. So the first arterioles to be affected in these vascular cases, as in diabetes and hypertension, are going to be the penile vasculature, and then the narrowing of this vasculature leads to decrease in flow to the penis, and therefore inability to achieve enough engorgement of the penis, and therefore gradual decrease in erection. So these are the systemic causes, and the vascular cause is very common, especially worldwide now, because of the diabetes and the hypertension, and the metabolic syndrome pandemic, which includes insulin resistance. In addition to diabetes, hypertension, dyslipidemia, and hypercholesterolemia is also another cause which leads to plaque deposition and narrowing of vessels. And these is leads to gradual decrease in the erection, and the morning erections here are also affected. Another cause of erectile dysfunction, the third type, is going to be the neurogenic, where the nerves are not effective. So this can also be due to diabetes, because diabetes causes neuropathy, that is the deranged sugar levels leads to stress on the nerves, oxidative stress, that is called, because of the increased sugars they act on the nerves and they decrease the efficacy of these nerves and the sensitivity of these nerves. So nerves are very important because because of the nerves, the sensations for the erection are received, and then these nerves release nitric oxide, which is responsible for erection. So neurogenic causes primarily would be the systemic disease, that is diabetes, which can cause neurogenic ED. Addition to that, if the nerves have been damaged due to some surgery, most common after radical prostatectomy, there is a very high chance that the patient can have erectile dysfunction, which can be neurogenic, and a combination of vascular illness, that is, the nerve can be damaged and the blood vessel can be damaged, or any other nerve damaging surgery which has been done in the past can lead to neurogenic, that is, the nerve related erectile dysfunction. One or more of the factors which I mentioned, that is the psychological, the vasculogenic and the neurogenic, can act together or in concert and cause erectile dysfunction. As in, if there is a vascular cause, initially there is decrease in erection, the patient starts getting anxiety as to why he is not able to achieve an erection. This further leads to failure in intercourse, which further leads to anxiety, and therefore more than one factor can be playing. As I mentioned, radical prostatectomy, the nerves and the vessels both can be damaged. That is, the surgery to remove the prostate, cancer surgery to remove the prostate, while removing the prostate, nerves and the vessels both can be damaged. So multiple causative factors can also play a role in a patient who is having erectile dysfunction. Generally, a very important point to note is the patient has good morning erections. That means the machinery for attaining erections is normal, and hence the disease is not very severe, and hence that requires just counseling and maybe a small dose of treatment. So this will be the first introductory talk for erectile dysfunction, wherein I mentioned the causes. Subsequent talks will deal in details with the treatment and different modalities of treatment and which treatment should be given to which patients. Thank you for your hearing. Kindly like and subscribe to the channel, and I'll be putting up many subsequent videos, and I'll try to make it in a simplified language so that a common man can understand. Thank you.